I'm Dr. John Kruse, and today I'm going to be talking about anxiety and ADHD. About a third of the people with ADHD do meet criteria for an anxiety disorder. It's pretty high comorbidity. There is considerable overlap between symptoms of anxiety and ADHD. So in addition to genuinely having both conditions at the same time, very clearly people who primarily have ADHD where it was confused as they had an anxiety disorder, and the opposite situation where someone has a genuine anxiety disorder and they were told or believed that the primary issue is ADHD instead. So both of them can mimic or imitate the other, but there are a lot of people who have both together. And some of the data we've been able to accumulate over the years seems that ADHD really does seem to have a contributing role, a causative role in increasing the likelihood of developing an anxiety disorder, whereas anxiety can certainly worsen ADHD symptoms in the moment, but it seems that anxiety disorders have less of a role or driving factor in causing genuine ADHD. Ways to diagnose or separate the two isn't just going through a symptom checklist, it's looking at the progression of symptoms over time, looking at the context in terms of what situations, exposure to chemicals or drugs or other things make the symptoms better or worse in terms of separating out whether someone has anxiety, someone has ADHD, or someone has both together. And if you do have both going on together, I would argue, unless someone's in a panic situation, it usually makes sense to try to address the, I would argue, more pervasive, fundamental, every moment of the day factor, which is the ADHD first. But lowering ADHD medications in the face of ADHD and anxiety is often the first course of action, but there are a host of other medications that could be added onto a medication regimen to address anxiety in the setting of ADHD, including serotonin reuptake inhibitors, serotonin-Norepinephrine reuptake inhibitors, Buspirone, Guanfacine, and there's a host of non-medication. Some of them are sort of life factor issues, like getting good sleep is particularly important for reducing anxiety and for helping with ADHD. Exercise, meditation, specifically behaviors, cyclic sighing and other breathing techniques, chanting mantras and yoga techniques can help alleviate or reduce anxiety, and certain cognitive reframings. It's often important to distinguish anxiety from fear. And fear is usually considered a reaction to an immediate threat or danger. Something is putting you at risk of serious injury or death right now. So if you're walking through the woods and stumble across a mountain lion, maybe it's not really likely to kill you, but there's a risk you could be maimed, not paying attention and step off the curb, and you suddenly notice a car racing towards you. Your response is a fear response. Anxiety, on the other hand, is also a response to perceived danger or threat, but it's in the situation where that's not imminent, about to happen that instant or immediately present. It's pending, and that could be minutes or hours away. It could be weeks away. It could be decades away in terms of something like apocalypse from climate change. Some amount of anxiety is normal. There are things all of us worry about or concerned about, but it's when anxiety becomes obsessive in terms of either consuming large amounts of time or impinging on normal functioning or behavior that we consider an anxiety disorder. Now, among the anxiety disorders, the most common one is one that we study the least, actually, and those are simple phobias, fear of cats or fear of the number 13, something like that. Numerically, the most common. We're not really talking about them here. We're talking more about general anxiety disorder, social anxiety disorder, and I do have a video on just social anxiety disorder and ADHD, panic. So panic is full-blown intense anxiety/fear with a large component of physiologic, heart racing, sweatiness, blood pressure going up, often nausea, tingling, changes in visual perception. I'm going to throw in PTSD because historically we lump that as an anxiety disorder. Technically now it's not an anxiety disorder any longer, but a large portion of the symptoms of PTSD that are troubling and disabling are in the anxiety dimension, and it's probably one of the anxiety disorder or spectrum issues which most closely overlaps with ADHD. So a few things further about anxiety. So anxiety and depression are often categorized as the internalizing disorders or problems where someone's focused inward, they're not acting out, harming others, behaving badly towards others. They're sort of hurting themselves, ruminating on themselves, focusing on how they perceive themselves at risk or lower than or less than in others. And that sort of analytic-based classification actually overlaps nicely with what we've learned in the last few decades. That is, with anxiety and depression, there seems to be overly strong wiring and an excessive amount of time spent in the default mode network. And the default mode network's major job is sort of ruminating, pondering thoughts about yourself, thoughts about how you relate to the world. So at one level, it seems, why would that be associated with ADHD, which in many senses behaviorally is externally driven? Part of why we see so much of the two together is increasingly we've seen in genetic research in psychiatry, ADHD and anxiety disorders have a strong genetic component, and pretty clearly for almost all individuals with either one of these conditions, it's not a simple gene or two which gives you the condition. It's what version of dozens and dozens and usually hundreds, if not thousands of these genes you have that increase the propensity or likelihood, given a certain environment, to develop ADHD. Many of these genes are in common for any psychiatric problem or disorder. It's not a specific class that only is increasing risk for ADHD and a separate specific class of genes which increase risk for anxiety. There's a big pool where having this version increases your risk for either of those conditions. And what we can see is that anxiety does not particularly lead to a full-blown ADHD diagnosis. Anxiety can worsen ADHD symptoms in the moment, but having ADHD does measurably increase your risk for later developing a full-blown anxiety disorder. Again, separate from comorbidity or the two occurring together, what I see clinically as often a problem is where someone basically or primarily has one of these conditions and it's been mistaken for the other. And the confusion, misdiagnoses goes both directions. My impression, yes, I'm biased by focusing on ADHD and being more aware of it than maybe many of my colleagues, too, having been around longer. So 30 years ago, when the dogma was no adult had ADHD, so sort of by definition, you're going to have lots of people who genuinely had ADHD where it was completely missed. And I've seen individuals who were treated in the mental health system, including getting full-blown disability benefits for depression, for anxiety, when they might have had some of that, but prevailingly and primarily it was their ADHD that was the disabling, dysfunctioning condition, and particularly confusing or worrying to their treating team. When the depression or anxiety was treated, they were still not very functional in society. I've also seen people who were hospitalized and they were given a diagnosis of an anxiety disorder or panic disorder because the person was staying way up late at night. I've asked the clinician when they were discharged later, were they anxious? Were they saying they were worried? Or no. Why would you think that this was an anxiety disorder then? Well, because they stayed up all night and they were kind of frantic looking and it didn't seem to be mania. So again, I've seen people in numerous clinical situations where the ADHD was missed. So specifically looking at symptoms, distractibility, making simple errors because you're not paying attention, losing things, getting off track, impulsive, blurting things out, interceding, jumping in the middle of situations, intruding on other space, hyperactivity, either micro fidgeting, tapping pencils, shaking your feet, or pacing back and forth. Those could be symptoms of ADHD. Those could be symptoms of anxiety. And another one is the sensation, or if someone describes, my mind's going a mile a minute. I'm always hopping around. That could be a sign of anxiety, could be a sign of ADHD. So how do we separate out the two? So one thing, and this has been at least one study looked at this, those symptom checklists. So if you listen to a TikTok video and think, oh my God, or your friends say, you have ADHD and you're given this list of symptoms. Are you distracted? Are you losing things frequently? Is your mind going a mile a minute? You might feel that you've confirmed to yourself, I have ADHD. I have 9 of those 10 checklist items. What the study showed, but if you watch a different TikTok video that was focused on anxiety disorders and ran through their checklist, you might be coming away convinced you had an anxiety disorder. So what this study showed is that extensively tested, validated self-report scales we have for ADHD aren't very good at differentiating ADHD from anxiety, and scales we have that are purportedly measuring anxiety don't do a very good job at all at differentiating ADHD from anxiety. What they're doing is saying you have symptoms that are compatible with either of these conditions. So diagnostically, what we do, what's important is to figure out the context and the course of time, asking this person, how long have you been leaving your phone in the refrigerator because you're distracted doing something else? Is this happening only in the days before you have big exams at school, or right after your ex broke up with you? Or is this a constant feature and you're misplacing items, since childhood, and everyone knows that you're sort of at the pig pen room or leave a trail of items behind? Usually, if the two are together, it's ADHD by definition is showing up early in childhood, and anxiety disorders can start then, but usually are more becoming problematic later in life. In addition to the context or just the general patterns over time, looking at what are the things that specifically worsen or improve, and sort of how present or what scenarios or situations are your symptoms present in. And then the third big important thing is asking someone what they're feeling at the time. So if you see someone drumming their toes and fidgeting, asking them, what are you feeling right now? And even specifically, are you feeling anxious? One answer to one question isn't going to completely give you a diagnosis, but in general, people with ADHD give a response like, I was just bored. I was not really feeling anything, or not even aware they're doing it. Most people who are anxious are going to say, I'm anxious. I'm worried about what's going to happen tomorrow when I confront my boss, or I'm worried that I don't have the rent available. It's due tomorrow. So again, not always, but most of the time, if you ask someone what they are feeling, how that correlates, most people with anxiety are aware of some heightened level of tension, worry, fear, concern. And so getting back to something like, is your mind going a mile a minute? Asking someone, well, what kinds of thoughts are you having? Are they only worries? Are they only fears of what's horrible things going to happen? Or is your mind just bopping from Taylor Swift to the latest football game to whether Joe Biden got enough votes in New Hampshire and what you're going to eat for lunch? Or if that's all bouncing around without any anxiety, it's much more likely to be ADHD and an anxiety disorder. So a few other things talked about two going together. There are some situations where ADHD may have a protective effect against anxiety. And one is about a third of boys anyway with ADHD in childhood have what's called positive illusory bias, where they overestimate their abilities and are generally positive and cheerful and sort of oblivious to the mistakes or problems they're causing. That may actually protect you against anxiety. Hyperactive, impulsive ADHD, where risk-taking, doing things that are really exciting, threatening, dangerous, is actually gives a sense of calmness and sense of purpose and joy, so that they're actually calmer in a situation where other people might feel anxious. So again, it may be protective in that sense against anxiety in those situations. And the opposite situation, there's some evidence that people who are particularly anxious and have ADHD are less likely to act impulsively in a variety of situations because they're worried. Yes, they have a tendency to blurt some things out or jump in where they're not intended, but if they're simultaneously worrying they're going to do those things, that puts the brakes on some of that. In terms of why might ADHD drive anxiety disorders, most of the emphasis has been on two sort of big different categories. This has not been studied that rigorously, but it makes genuine sense. So some of it's been repeated over and over again so much, and clinically it makes sense. So one is that kids with ADHD do seem to get much more negative feedback from parents, from teachers, from peers. It may be harsh, but if you're always being criticized, that's a recipe for fearing, am I doing something that I might not even be aware of that's pissing someone off, that's stepping on someone's toes, that's cutting a line when I wasn't even aware there was a line there. I blurted something out that I shouldn't have and hurt people's feelings. Criticism does seem to feed in likelihood for developing anxiety disorder, so ADHD could contribute that way. Another possible origin or etiology by which ADHD can drive anxiety disorders, pushed by Russell Barkley and other neuropsychologists, is that if you have less ability to regulate your emotions, less control over executive functions, less bandwidth for dealing with stressful situations, a situation that might be only mildly upsetting to others may reach a level of greater anxiety, greater concern, greater chaos because of impaired executive functions. Separate from just getting negative feedback from society, many people with ADHD who don't complete tasks or aren't achieving at the level they're where they're intelligent enough, they're smarter than these people, and yet they didn't turn their homework in. The teacher might not have yelled or anything, but they got a grade. They were rewarded at a different level. So not completing things, not accomplishing things at the level you think you might be in itself, even if other people aren't directly giving you negative feedback, also a recipe for developing anxiety, potentially disorders. That doesn't mean everyone in that situation has to. And also intrinsically part of ADHD is missing information. If you know that you occasionally, when you're talking, forget your words more often, or you go off on track and you ramble about 17 different things. You might be losing your audience, but you're not even aware usually when you're doing it while you're losing your audience. That could make you, more likely to develop anxiety because you don't even know what you're missing if you have ADHD. So there's some conflicting data. Some have found that parental influence has minimal effect on whether you're going to develop an anxiety disorder, but there's a few good studies that suggest usually they're studying mothers, supportive, helpful, nurturing, and helping someone deal with their ADHD symptoms helps decrease the likelihood that that person might develop an anxiety disorder. So jumping along to treatment, first and foremost is always, if someone is on stimulant or even other ADHD medications, it's almost always consider reducing those agents. Typically, not absolutely everyone in all cases, if you give stimulants to someone only with ADHD, you often lower the degree of anxiety because they are processing more effectively, they're missing less data, they're succeeding better, they are in tune with themselves and the world around them. If you give stimulants to someone who already has an anxiety disorder, almost always it jacks up anxiety higher. So if someone is having particularly an exacerbation of anxiety, and I saw a lot of this during the COVID Trump years, where there was more uncertainty, there was more division, there was more threat to individuals, many people found that reducing their baseline level of stimulants helped them reduce their anxiety and still function. There is often huge amounts of resistance, because part of it is people are afraid you're going to take away my ADHD medication. Usually I frame it as, we know anxiety itself boosts the sympathetic nervous system, boosts the release of primarily norepinephrine and epinephrine. You're getting more of the chemicals that the stimulant medications release themselves from your own body releasing them. We don't need to duplicate that. And it's likely when the anxiety evoking situation is gone, if it's appropriate, we can go back to the dose that someone is on earlier. Experts tend to push serotonin reuptake inhibitors. They work well for a range of anxiety symptoms. They work slowly over the course of a few weeks. I usually go to an SNRI, serotonin and norepinephrine reuptake inhibitor, sooner, because the norepinephrine component is likely to be of some benefit for the person's ADHD. So why not you're adding something else on additionally, why not kill two birds with one stone, as it were? And often that helps them lower their stimulant because they're getting more norepinephrine available with the SNRI. Buspirone's only FDA-approved use is for anxiety, but there is some moderately okay research suggesting it may directly have some benefits for ADHD. So it's a good choice for a situation where someone has both conditions going on. Guanfacine, lots of people are not as convinced that it's wonderful using it alone. I mean, clearly it was tested. It works well for reducing some ADHD symptoms used alone, but it's often used in combination with a stimulant and often helps decrease anxiety in that situation. I've also seen people use Propranolol often for social or performance anxiety in the setting of ADHD. It can still be helpful. And then some of the things I touched on in the take-home message. Getting good sleep is so important for functioning in ADHD, but it's also hugely important for anxiety. One of the most potent triggers for full-blown panic attack is sleep deprivation. Other ways to reduce anxiety separate from medications are breathing techniques, and the one I like the most is cyclic sighing. So I have a video on that, and that can be employed anytime during the day. It's kicking in your parasympathetic nervous system, which is your calming, dampening down, usually within a few breaths. Usually it makes sense to try it for a few minutes because more sustained, ongoing parasympathetic drive and reduction in sympathetic nervous system. Meditation is helpful, but particularly when someone's already agitated and someone has ADHD, meditation or purely sitting and trying to clear your mind can be difficult. But mantras, and I do have a video on that as well, mantras are a good pathway into what seems to be the same meditative state. This is not the default mode network ruminative state. This is a more clear, but not engaged, reacting to everything in your environment. Exercise, either in the spur of the moment or on an ongoing basis, are good modes. And yoga, which may be straddling the meditation and exercise, is again a entryway for some people with ADHD into meditation because their body is doing something, they have something concrete and physical to focus on, so it can be easier. In addition to these medication and body approaches, there's certainly a host of reframing techniques with CBT. I often describe anxiety disorders as problems with attention, because the problem is you're focusing on something that either isn't a threat now, isn't ongoing now, isn't going to damage you now. And your task is to get engaged with what are you trying to do now? Not evaluate yourself or evaluate whether there's threats. If there's not threats, just if you're not in immediate danger, just go ahead and work on what you want to work on. And some of these fit into, again, I have a video on this as well, what I call the quest, not test. That rather than making every scenario or situation into a test where you can fail, which is a recipe for anxiety, try to sort out what is your overarching goal, what are you striving for, what are you working for, and then even if you're not succeeding in the moment, even if it looks like a quote failure, almost always you will have other chances. You will be able to revise, find a different pathway to work on what you're doing. It's a powerful anti-anxiety effect. So that's about all I have to say about anxiety and ADHD. Stay healthy, stay happy, and I'll be back next week.